our AAMS and separate from the clinical competency board, which is in keeping with gold standards, the ISO gold standards for medical accreditation. So this brings us to here today. We have a body of knowledge meeting that was moved from last month. We were going to be in Germany for our institute and my day job, the Academy of Orofacial Myofunctional Therapy. And it looks like we'll have that body of knowledge meeting, which will drive the educational competency, which will drive the clinical competency and help create standards and parameters for what we have an international research consortium, facial myofunctional therapy, which will do a multi-site, large-scale randomized controlled trial to do a proper validation study.
Application with therapy could
has wonderful to hear Maxime's
very important.
You meet one autistic child, and that's the same whether it's an individual with sleep apnea or dysphagia or some type of articulatory disorder. There's commonalities, but there's still so much individuality and uniqueness that we have to figure out, how do I help this person specifically? And then there's the lack of evidence-based practice, which Mark and all the OMT team, as well as all of you on here, have tried to make a huge impact. And it's just all of us continuing to work together.
My name is Mark Richard Muller. I am the Executive Director of the Academy of Applied Myofunctional Sciences. We are currently
actually are
with our fifth
so what is the solution?
AAMS
I think
Congress.
All of us are a part of that.
And we have a series called Fora or Forums.
Because every single one of us sitting here on this Zoom session, as well as all those that have
so we have over
attended
150 speakers, well over 1,000 registrants. And we have a dynamic environment. We feel collectively that we're hitting a tipping point in our emerging field of medicine. So it was an idea that we had. Let's get people together. We're going to be generating white papers. We've got actionable topics, weight-breaking symposia in world congresses. So one of the hot topics of the day, this being our seventh forum. We started with reimagining the first 1,000 days of life, and we will go all the way up until Friday, the 24th of September, when we will have a forum on research priorities.
A couple years ago.
We will have our eighth forum on Tuesday, Tuesday, the 22nd, and that will be on practical application for infant, pre-crawling, crawling infant, toddler myofunctional therapy. So that'll be very exciting. These forums are all at 9 a.m. Pacific time, 1800 hours or 6 p.m. Paris time, midnight Hong Kong the following day, and 1 a.m. Tokyo. So jumping into today, our forum is a guided panel discussion with key opinion leaders from within our community. And it's something that personally is near and dear to my heart. A number of times I've gone to Johns Hopkins, having been invited to speak in grand rounds in their sleep medicine group. And I've made a point of scheduling time with some faculty at the Bloomberg School of Public Health. And even, you know, I've had some really nice meetings with their dean, and the issues that we're facing around myofunctional therapy have always been, for me, on the horizon, both on the horizon and upfront in my face as public health issues. For instance, we have a Perinatal Action Coalition, paclac.org. I got invited to speak at their annual meeting at the California Endowment. It's our largest foundation here in California. And I presented one of our colleagues' real works, something I've been involved with, we'll talk about today, the Teste de Linguinha Frenulum Inspection Law. And this is a group that helps set policy nationally and internationally for lactation consulting, for perinatal application of policies and procedures for large hospital groups. And this was new information to them. So when I think about the public health implications, we organized a symposium at the Stanford Sleep Epidemiology Research Center with Maurice O'Hyan and our institute, the Academy of Orofacial Myofunctional Therapy, 4 years ago. And we were talking about strategies for advancing myofunctional therapy, as well as
thank you very much, Heidi. We're so excited about
the wrap up in the consensus.
Your SBIR
Dr. O'Hyan,
which I'm sure it will.
He
and
looked at all of the
we want to see commercialization of products like yours
community assembled, and he said,
application.
"This is a public health scandal."
So we're going to shift gears a little bit here. Denise DeWald,
when we know the implications and the correlation
pediatrician and internal medicine
specialist, people who consider themselves leading researchers out there
a number of years
ago
with
they
us
may consider a good fight and saying we don't have to cut.
Claims that it had a little bit of an impact on her.
There are major national medical societies saying
and moving to
putting this
Cleveland
in actual
so she could go to
writing,
Case Western
children
Reserve
can trip and
be a
fall
sleep
at the
fellow,
age of 12
and
or
she's just
13,
starting a
or they may even
project
have a
with the
bicycle
NIH,
accident where it will tear and resolve itself.
She's a recipient of this year's
National
AAMS
Medical
Hippocrates
Society
Gala
Guidance Statement,
Rising Star Investigator
Medical
Award.
Society, a pediatric medical society.
Sorry.
So
that's right. She won the
title
Chrysalis
here today.
Award. We created a
AAMS
special award for
Public
her
Health and Myofunctional
because
Therapy.
she's,
What is the cost
she's emblematic of
treating
transformation
someone
as
who
well.
suffers from orofacial myofunctional
thank you very much for your leadership. And
orofacial
we're
myofunctional
really
disorders is a term
to be
that
collaborating with you, Denise,
come up
and
with.
we look forward to great things to come.
It's made it into the medical
And
literature.
she's going to talk a little bit about dreaming about
what
what's
it stands
possible
for.
Technology
It's an
in the
umbrella
future.
term of syndromes, phenotypes, and perhaps even disease states that are related to orofacial myofunctional disorders or orofacial myofunctional rest posture, chewing, breathing, swallowing, the stomatognathing system. Being a presenter great term that's often used sometimes in China and in Germany and France. But we have a great lineup here.
So I just want to talk. So I'm not
read
quite
through.
a thought leader yet. I'm just
do you want to read through a couple of these questions
or
here?
a research fellow, but I want to talk about what sort of technology that would really move forward the basic science of myofunctional therapy. And so in particular, MRI. I think dynamic MRI has enormous potential for elucidating what's actually happening. And so I just want to remind us what sleep apnea really is. So on the left here is a normal airway, which during drug-induced sleep endoscopy is not floppy. You can
Director
see
of the Academy of
pharyngeal
Applied
walls,
Myofunctional
you can see
Sciences.
the glottis,
We
here's
are
the
currently
soft
underway
palate.
with our
Sleep
fifth
apnea, it's floppy.
AAMS
So the
Congress.
soft palate is floppy.
And
the muscular
we
pharyngeal
have a
walls are
series
floppy.
called
And it's
Fora
really important
or Forums.
to
And
understand
this
the
series
innervation of these
is
structures. So these
public
are
facing.
innervated
So
by
we have
cranial
over
nerves 9 to
150
10 that
speakers,
feed into the
well over
nucleus
1,000
ambiguous.
registrants.
And this is what I call
And
the
we
holy
have
grail of
a
myofunctional therapy.
dynamic
This is a functional MRI study of just a dry swallow in the scanner of people, young men who were normal without sleep disordered breathing, and then young men with sleep apnea. And this functional MRI measures it measures blood flow in the brain. And what they found was that this was done by Dr. Parthasarathy's group in the University of Arizona, that the nucleus ambiguous lights up in people who are normal, who have normal swallowing, normal breathing during sleep, and it does not light up in people with sleep apnea. And so that's really important because we have to understand what's causing this disuse of the nucleus ambiguous, this disuse of the swallowing center in the brainstem. And then we need to understand how we can turn it back on. And so I think that using a dynamic MRI, and I'm just going to play this, is that this was done back in 2012 by Zhang et al. And that this is technology that's becoming more and more available because cardiac MRIs is like ultra fast MRI. And so you can get this beautiful view of what's going on in the tongue. Because like what Heidi just said, is that what's going on in there? We need to understand what's going on in there. And while this wouldn't be something that you could use for every patient, but this is something that will be a really important research tool to understand what is the aberrant swallow and how can we correct it? Like, what do we need to do to correct it? So that's all. That's what I'm trying to do.
Well, that is so exciting, Denise, and we're really excited about what work you're interested in, and we hope to see great things from you in the future. It's really great to see you on this journey and to be witnessing your work and your ambition. I'm going to introduce our next panelist, Dr. Karen Sproit, who has been such wonderful experience to get to know her. If you ever have occasion, to collaborate with her, she is such a great team member and so passionate and caring and sincere. AAMS forum. This role that I'm in with the AAMS as executive director is a volunteer job. I call it my name is Mark Richard Muller. In my day job, I'm managing director of an institute, the Academy of Orofacial Myofunctional Therapy, and I'm excited, to have a little disclosure that our institute is collaborating with INSERM, the French National Institute of Health, to develop a project to help do validation studies and international multi-site research with myofunctional therapy in collaboration with INSERM and Karen Sproit's research lab there. And so we're going to be pretty in the near future getting 3 PhDs focused on producing, at least 20 or so high impact factor journal publications, as well as a body of knowledge retreat, which we're hoping to get off the ground in January of 2021. But thank you very much for your leadership and your passion and your vision, Dr. Sproit.
Hi, Mark. I'm touched. Okay, speeches now. So thank you again for inviting me. And it's with all my heart that I participate in these sessions throughout this month. I've also learned a lot, as Heidi said. So this sharing of many different perspectives is incredible and is exactly what a young field needs. So I listen with a research ear, with a statistical ear, with a neuropsychological ear, and from a sleep perspective to all the talks all the way through this month and also today. And if I can summarize what I've learned today is that actually technology is in the center. So on one side we have health, the promotion, the prevention, and the treatment. And as Dario said, yes, we are mostly focused on treating. But then again, you have this boom with technology, and COVID learned us that technology can move things forward very fast. And then on the other side of technology, you have the collecting of the data, the sharing of the data, as well as what I've learned from Heidi's talk is, the training, the continued training, and not, the 1 hour intervention. So technology is there, but the question is again, and we heard that from the other talks of Capable, who owns the data? Where does the data go? Who shares the data? Who is collecting the data? And then which kind of data? Because as all of us and each of the apps have shown that it all comes in different formats. And then from a research perspective, or even just from a data format, database perspective, to connect all of that is a tremendous work. And I think Darius will know that, and Denise also, anybody that is doing sleep research the moment we need to start in EDFs and everything converting to make all the different programs talk to each other, it's a headache. So it's wonderful to have COVID move these things forward, unfortunately, because show Zoom, and we would never have had the opportunity to meet and to interact in this format if, you know, we were not forced to do this through Zoom. So technology is there. And so with myofunctional therapy, from what I hear and what Mark and I and the team will discuss further, is the objectivity, because the field is blocked a little bit by the objectivity. And I've heard from the group from Brazil and other groups with their apps that there are parameters there. The question is now, who is going to collect it? Who is going to share it? And how are we going to have that mingled into a continued intervention, a continued training of the ones that need it? Because apart from who is collecting and what you are collecting, it is also disease or disorder linked. And if you look at the chats, we already had the point being raised, like, let's try to do some activities, or let's try to give some exercises, or let's give some recommendations. And then it becomes tricky, because to who does it apply? And then from the brain plasticity perspective, we also know, and I'm talking from a neuropsychological point of view, is that if with myofunctional you train and you improve the myofunctional functioning, but if you give random information or you collect random information, just like neuroplasticity, it is functional, it is adaptive, but it can also be maladaptive. And so it's a coin with two sides, where you need, as we discussed, those educational certified people, the good research programs right on the spot to really streamline this technology and go in both ways to have it connected. So thank you again for inviting me and listening to all these different people, and hi to some of those that I know very well personally. So thank you, Mark.
Thank you very much, Karen. And it's a real honor now to introduce a dear friend and colleague, Dr. Sharon Keenan, who founded the Palo Alto School of Sleep Medicine, and she helped launch and build the sleep residency program at Stanford School of Medicine, which is kind of like a mothership for many of us around the world. And she's also a colleague in our institute, the AOMT. Sharon, you know, glad to have you here batting cleanup. And also, you know, my heart goes out to you. I don't know if you lost your house recently. There have been tremendous fires in California. Thank you for, you know, soldiering through in our Congress here. And thank you for your passionate dedication to science.
Thank you, Mark. Thanks. And thank God I am talking to you from my house. So I was evacuated, but back again. My heart goes out to so many people that are still suffering. It is a bright and shining star that we turn to, you know, in these moments of time with the world in the state that it's in.